Today we'll talk about what TBI is, how the VA rates it, and how you can prepare for your C&P exam. Our goal is to make sure you fully understand how to describe your symptoms and present your strongest case. This training is presented by Paul Bunn, CEO and owner of Veterans Outreach Ministries. For more support, visit us at www.vetcenters.org. Traumatic brain injury, or TBI, can be caused by many things, including a blow to the head, a fall, or an object penetrating the skull. Veterans are especially at risk due to combat exposure, vehicle accidents, and blasts. Symptoms can range from mild to severe and include short-term memory loss, trouble following directions, frequent headaches, personality, or mood changes. These symptoms may come and go, but when you're at your C&P exam, it's important to describe your worst days. TBI can be directly service connected if there's proof of injury during service, like medical records, line of duty reports, or treatment for a head injury. It can also be secondary. For example, TBIs often lead to migraines, seizures, PTSD, or sleep problems. If those developed after your TBI, they may qualify as secondary service-connected conditions. Strong evidence includes service treatment records, imaging results, neuropsychological testing, lay statements from family or coworkers. The VA doesn't rate TBI just on the injury itself, but on the residual symptoms you're living with now. They use 10 categories called facets, which cover things like memory, judgment, orientation, motor skills, headaches, mood, and communication. Each facet is scored from 0 to 3, or total impairment. The overall rating then ranges from 0% to 100% depending on severity. The 10 areas the VA looks at are memory, attention, concentration, executive functions, judgment, social interaction, orientation, motor activity, visual spatial orientation, subjective symptoms like headaches or dizziness, neurobehavioral effects like mood swings or personality changes, communication consciousness. You'll want to be ready to describe how your TBI affects each of these areas in daily life. At 0%, the VA recognizes you have a TBI, but there's no real impairment. Your symptoms don't interfere with work or daily life. Example statement: my doctor says I have mild memory issues, but they don't affect my ability to work or handle daily tasks. A 10% rating is for mild impairment in one area, like occasional memory problems or headaches. You may notice it, but you can still function without major changes. Example statement: I forget small things like appointments, but I can still manage work and daily responsibilities. At 40%, the VA sees moderate impairment across several areas. Maybe your memory, judgment, and social interactions all cause issues. Work and relationships are noticeably affected. Example statement: I lose track of tasks at work, struggle to follow conversations, and sometimes make poor decisions because I can't focus. A 70% rating means severe impairment in multiple areas. You may need help with daily living, and personality changes or mood swings are obvious. Example statement: I forget directions even when I've been somewhere before. I need my spouse to remind me of medications and appointments. I get angry quickly and can't control my mood swings. The highest rating is 100%. This is for total impairment, loss of independence, loss of consciousness, or needing constant supervision. Example statement: I can't live alone or manage basic daily tasks. I need full-time help from my spouse because I forget how to do simple things like cooking or paying bills. The highest rating is 100%. This is for total impairment, loss of independence, loss of consciousness, or needing constant supervision. Example statement: I can't live alone or manage basic daily tasks. I need full-time help from my spouse because I forget how to do simple things like cooking or paying bills. At your exam, be specific about your worst days. Describe memory issues, headaches, or mood swings in detail. Use real-life examples of daily struggles. Bring medical or neuropsych testing if you have it. Example statement: I can't remember what I did yesterday. I get angry quickly, and I rely on my spouse to remind me of daily tasks. And statements from family or coworkers can be powerful. A spouse can describe memory issues, mood swings, or reliance on reminders. Coworkers can describe difficulty following instructions or staying focused. Example statement: my wife has to constantly remind me of simple things, and my coworkers notice I can't stay on task. To strengthen your claim, gather service treatment records and line of duty reports, neuropsychological evaluations, a 30 to 60-day symptom diary, lay or buddy statements. Example statement: I submitted my medical records, neuro tests, and my spouse's statement about my memory and mood changes. Here are key resources to guide you. For more resources, visit us at www.vetcenters.org.